largi darage kalyer balu alba belak malumi belak mal globo bay dorai bo me sabalwal mabli takol warar elangi oy magatagata Barandi musulargu lekate tararo maoi magurga ebe ori re dagasoe Barandi musulargu lekate tararo maoi magurga ebe ori re dagasoe Maral yo rey Ikaw maral di meanglan Elisel belaw regi Adawa sa'yo alin Bay doray Mo me sabalwal mabli Takol wararailangi Awe magatata Barandi musudargu lekate tararo maoi magurga ebe ori re dagasoe belak malumi belak malklebo bay dorai
Nagpagse, solah malungil ko sa ngayon, nagkidaro ko sa Superstation ng WWFM. Solang kung eransisong walurior, magkukna mo sel time at update ra COVID-19, nagkidaro ko il korap esel al-dadu umalog ko il la COVID-19, tungwalan ng Mr. Khafar, EOC, MHHS EOC. Yeah, that's how you say it. So lang at mo brief frigid ragir rogu chances may update frigid ragir rogu gid mo pangayar adar pelaw malwa se so lang malungil maututaw ngil ko sangay ngil afternoon and more tirgel ko nga different time zones lo mes sa social program especially tirgel nga rapi area ma San Francisco, Seattle, Washington, Denver, Colorado ngil ko sangay lego review marube ngil maututaw direct mo ra East Coast ngil nga New York modula New Jersey meteng mera Florida ngil ko sangay lego review and Honolulu, Hawaii. We don't forget about you, Saipan and Tinian, and also Ganya Guam, Guahan. Ngil ko sa nga legor kami. Talo siya sola kultur kami, we kung ala nung sa Kafar Werbalaw, morong tigay girgit, ra tigay update ra COVID-19. Kafar.
Talo siya malungil, kapsingin mo ka tulig, wagil flamdo, malungil sils, and morarokul, los ilme joiner git al uktemel at talk show. Agi brenga sule me tulig mar adara Diaz broadcasting agi direct kul brenga sule adara rel belahol mal bloil konge lobonget selbek temela talk show.
Okay.
Gi ay amare tulig ng wal kuram lo last minute tam le cancel ra talk show last week. Madingi lo semle November 11 mong wal Veterans Day sils ra gidar veterans.
Okay.
Idi ayamal gidel se direct kal uktomer sergidra next Thursday direct kal Thanksgiving magadel pura direct kal agora mo gidel lolungul next week.
Okay.
Resume ra following week mang agidi ayamal gidel last week direct kal di OI sir otherwise next week direct kal bodolungul ng Thanksgiving mungil el time el uktolungul ndi unless suko mong monya Claude or Udels الجيرات المساعد السيجيد السيلسة of course هذا يقول جيت له سيتبرع إيرم.
Anytime.
لكن تولي مغمان مساول again البطاقة updates since last talk show. مال البطاقة testing أنا مغتموك على سلا community ما direct هيقال سكوجيل ماي دي thankfully at time من سيد الوسندية active cases. Maldir ka the 8 cumulative cases gayid الرغول na recovered alak alwidam le last المدang الجيس رجيدam le tedera October 8 if I'm not mistaken since then ng goramal di mila rogoy da mringa sule adra bluet tulig raigal marail omrus ma direct na motelal outreach el mora bubble daw ma ang ayang al mablilyo nagi direct mringa sule adra igel blue lo sabil mel me either the members malubtam le may participate regayid community testing so well over 700 tel adam la test sila community since October dori da start community testing ra asahi Ballfield tama mamilmol metulig el continue gayid testing ma omrus ra kakaros el blue di so mamil low ice madingil sing am la tob da press release el morgomir adra media ma direct kal ngaraigal السوشيال ميديا بيج را MHHS الوسيجل لومروس المليجيل نارجيل الويك را السل أوريور أم لا cancelled or postponed rather كده البان التلقوك مرا الميل كمل دي لا يبدول بكده مقول السيجي تديرك الموسبير سيل الجيم توديني لو سين national gym up central padre جيد من دي من السمام لو تبدي سيجي دي tentatively وطوبة atara schedule kung mo ay susungay nga ra resume ra omrus ra sel orior. Magidil ngit trabeklado sa dilbora sa gidil Facebook page ra Ministry ra Health Human Services direct dil ranks ra igagidil radio stations ang to ba igel latest el schedule ra tokor omrus. Direct tulig el tokar adlogel gidel sel Pfizer vaccine el mora pediatrics so 5 to 11 years old. Di so mamlo ay sa kadam lamay baby doses we have them on island and again ay gal korap tokol events albang gimukot magklat training rakuk radamamar omrus ese tulig akuk ngot al file ngot al klungil orus ados peringin morarangal kama require kama mal trainer tirgal nurse tiramrus ra ay gat fadal mo trainers legid al lorus al morarangal legid al ngitra coloring our parents di bolongi ra oya guril sub del mo ay sa ngara ka mo start del mrus ra legid tirgid 5 to 11 years old. Ese tulig a Pfizer at time di imol COVID-19 vaccine el blal authorized ngin mo tegi del age group. Di lakal within 1/3 or sel dose lo laring year moklolat. E way get tilung gerel lorus sa lobal morarangal kum girel nga niyamal mo will training ra nurse gi mo tegi de mo ay sa adra blul se mo ngara tamel of the triar ngal girel segi del 5 to 11 years old. Ese tuligal adi mo sisiwa requirements ringi tirgal guk platorus til tigib klolngan tirgal 12 to 17 mo require a parent lobangal gal membros o sisil time mo require sa igid lora consent mo igi olingit wasil al time lore sa parents lore ay igid lora documents el volos pelo tirgal gil merapat memel igid melar orus tuliga talkshow gid al arsus sa dangat lang sabela Dr. De La Cruz Dr. Bing el guk mebang gid al arsus imreng asulel guk maskita abebira ulaklat kaya sisil time November 14 le World Diabetes Day nasa edel guk koram sa teal mongkoram tilgib el mut el qora dio maklat gid gidela okobila rakt el sukal wasa ba edel bro el time el aldir ka ngara al sila pandemic ngara gel qora gidel guk matmok el malubo ka namrul gidela ulakaruila pataged mda ka bodo take the rakt al diabetes. Thank you, Dr. Bing, for joining us again. But before that, tulig maningas sa kora namas kita abebir updates.
I say.
Di akumdaseng egal nomre kalerul Sunday dimla kata ngara talk show di guay salwase dirigel mlera last Sunday 117 narsel United flight tamle test negative ra airport sa May yamro ko kada madangelo sa klugo katuguk mel melar sel day 5 test so hopefully di mo ngilak robot to ra klugo sel test
en area question
oy
ngara so media lang ngara newspaper el girit tirgel melar sel tirgel 20 samel adel atra odel belum melar sko kim dara Macau May according to the newspaper tirgare lang confined to one particular area mangira action na government so what course of action they going to take the question lang al goromil kirela COVID-19 as tirge komla move in and test the team make sure and diakal el carrier taking the COVID-19 virus
ngoy set tulik so agel rokul requirements ra health Gidil mga smokra uera nga sa skogil may ay giblem review mang tiro ko 27 namle test negative submit ay gidil PCR negative test results nilara edit club sera uera nga sa skogil may sisil time tamle submit ay gel vaccine recorder term los mamal review what approval was oy gidia a fulfill gel book requirements ra entry requirements ra COVID egida madingila Untitled Chapter mategi del weekly United flight sa lame nga niya alamam mo report mo test tisel arrive mo tigegi del 27 able the test til report mo negative mo
digero flight will coming in regardless akiri will performer say the testing was say
adi mle ora exemption tulik selmle flight tra Taiwan mle book travel bubble tirigel tourist digital madingilo sa lamo diakas kogil mera el albuil mo diakas kogil at Taiwan and for the rest of the month hindi tigida dimle ora exception or sa gidel test airport tirigel book narsel travel bubble hindi gagid rogul el charter mategi del weekly United flight tama directly gas kogil sold out sa lameng tawdar alamam mo test til
la sel domestic lang cook tourism out of Korea lang Carl Guterres the former el senatore el former governor Guamre lang aureo lo atra Korean Airline ma Jeju Air el create el bubble el cook tulong la Korea tiar lang cook gire seguido tolomra me agumese ngaria tablol scheduled flight malo charter flight el meso is para December before Christmas agi kom gire
Wai se tule ga gigi dal tait sa koram la madung hindi gidir ko riolo mentri ko kadra tirgal partner agencies sergi tra immigration ma control ma biosecurity kuk mo si angir sergi del motetele lagi del travel bubble flights ra kuk Korea direct ke tule la kuk mornya TLL mornya kuk revision lagi del entry requirements sergi tra sela December by the litter listeners lo se will confirm they'll finalize gigukpera a talk show with the Saudi sel guk mo bes tetele la directive la motobra sometime next month sela
etikita gukora di suggestion na lo se timing ra rogu talk show mi amo merbot ba rogu il brede la information no la decide to prioritize lo se morgi maru bendia me subi sugu na next week ngaringia at sungula blur oreor solang mo mesel bedula que el bebirade es una mos bedrulil moduleokla asugo mo meseri lang a community spread in control sola dia asmera blur balance will direct lo meseli lo se del mora every other week mati mo yor kami we nga I'm ready for any changes
mo se tule kaman sulang itilagi dia ko rabdas lo se el al qura domesa egal existing el tetele la rele dong qura malungil mang unless ang mornya changes of course the
no I say
sige hindi sige ako ko mo tetele la ay del travel bubble flights ra Korea el mo start next month magidil ko ra omes girel waseng man mo nga protocol el guk mo sige del nga skogin nga Korean bay
okay tolmano
umdas hindi kay unless return nga ni
piasa lo ka di share at yale update Trasaibal.
Kalabo.
So starting Friday, which is clue on November 19, hindi na kalmotchen sa travel protocols sa musoy sa Bravalura Saibal.
I see.
So tirigel adal nga rakwam, mamarigel, almura Saibal. Amla modi al required al quarantine al sugum to fully vaccinated. Ya dalang okil nga al sila Saibal labo lakiringi fully vaccinated ar other ngin.
I see.
Oo. Direct kalwasay tirigel fully vaccinated almosoyis adi al require al test upon arrival.
I see.
I see.
Kira la direct morti la guida del meso someday soon en last que direct mo valor el procedure, I see.
Kita makatratar sa dulwasan di albal quarantine sel siswar adal fully vaccinated like adal merbela di fully vaccinated malmet ROM.
I see.
Okay, ROM and then test day 5.
Okay.
Indira as long as indira ngarniya pandemic worldwide, indira ngarniya cases al pop up and labi al dilmare at time to do away with completely modiaka testing malubang quarantine. Either a quarantine up or a tester still. So ay gida wal kora tools al those al navigate the pandemic.
We take one step at a time.
I say kodo mese komi ko gid o meseringi adjust al mo applicable al mora bululat. So ase direct kal sa ibala mo igigid al vaccination cards abol honor way igigid al vaccination cards rigida abol honor abulura sa ibal selbo the season this still ngari sigid al online declaration form al malgira dal mo online filling 48 hours before the arrival abulura sa ibal.
I see.
And then our unvaccinated dili ka sabihin mo soyi sabandit na di continual quarantine or tier.
I see.
Okay. So ang segide and then ding gira dan mo madangel wasay sel lultabdi abalura amrigel kaidan sa dir go remain al wasay al suguman di ham adar amrigel mo soyi sa abalura amrigel ang gira mal fully vaccinated gira mal test. Opo. So ay adi malamol mal.
Oh. And in the meantime, kita malamon practice again preventive measures, so I say, low mask, 6 feet, the practice. Even though kung lang magil requirement of vaccinations, and the girem practice again just to be safe.
Why say, Dr. Tedros na WHO, akmal mula say, do it all.
Oh, okay.
Even if makamla vaccinated, still mura mask, still physical distance, I get roku ya gira del loltirak.
Okay.
Okay.
So lang itulig alam ko na di shell mula ka telam ralas del share ako gimlet tewang lora Denver endra last month tulig mal clone mo the traveler lang especially mura mainland clone mo erura kana na memo mura eralbonya pandemic ngoy arokul ata girel lo mask mang telibel ko tarigi kadi emergency sel dolong lela kuam mahawain with the sigang al dangaras kogi o mask and unfortunately sa dia bes new normal sugo mong nganyar adal kura umdas sa mobrail direct odim transit el mo through Hawaii and mura mainland and girem register online direct ulaklat kal mura rokul adal top del belaw mura lura marigel wase ko man mo ngilo mes sa gigid requirements and dakal way kamam lora kuam magi dong okra food court airport dia kangaral gi modeng gi bu am temam board to singirun mo online mala ngarakkel mangarakkel mong gi pora Hawaii tulig ang direct kal malgora amasera da airport dakal tokolada practice ay gigid social distancing mong mala ako at taligibel mo tukod al mortirgel adal makatatal dakal ngar umrail hindi agim lamong dim na job mong saygi di kada di practice ay gagid at preventive measures mga roy dergi dar atal as much as possible ako moragel da borngi we should be okay saygi da ko koram le social sharing ilo sa tirgel mor omral dil bol korgi make sure ay get roguil el balul bol through malub sel balul borngi al book like rule requirements na wala lora.
Ya mama koram ngir kemer ngarba bladel es kini pigs kahale bo me mula sala ko mat agi mos paman mo kumitian na mo me dia ko mat ma dia kapser mangela ka mamtel mut pok mamal mor omraen mora kwa ma brigel
malungil tulig hindi sukum saygi da agi man mga lera adal wasem sukum diga lorus lora direct dia kadil to era am sabak qarqat direct hindi yagagi dia ba protocol base travel la mo require vaccination
self percentage lang at sa ne monitoringin mo nari 1 mo nari 2 lamasan mo nari 3% vaccinated the other vela wal open remain at 92
hindi akamal dir ngara 92 hindi sel ko podomo tirgal merus tirgagi dem gagden ngal ng angan yat telet telgibel mo riak morbab
I see
hopefully tidak kilsel ada numbers rin morbab hindi sa igi di 92% tirgan lamay get tablo lorus malum sa igi imol Johnson and Johnson igi damal mol metulig el merus sel booster shot
I see
del resume padra orio regi ko tobdra asukal gili
madin klar raw rengel kirela igi the difference between booster shot and third dose ay gigidre lang ta matelo nura red rooster ember ko makauti trangar ni makasahala mo rings yakso din mo triul taket tiama del wa se makase kamlutus modi segi del booster matay gidel additional dose
mo ise tulig melangel third dose ul mongongede lorus dios isiwa aklugel dios isiwa dosage ringima suma atang ilo Moderna malung Pfizer yung dios ingelong edel lorus mal dios isiwa segil ay diesel el mortirgel adal lo spering gigid long edel dose mo wal lo sisiw sel protection tir ma adal kukte karaktel ding ilat tablo dose segid ya mokterni so tirgigid tulo set moderately more severely immunocompromised tigal malbora am itut immune system tira ulus per segid long edel dose
okay kami mo aisra se wai kamamre la kamam maldim le kotta kingwa J3 ela kamamre la ki la motte mamle ko al ko motte dia subda se tirgel mala Johnson amna mo giril me ora kiri mamal mrale konge okay.
Ngay se tuling melar time tirigel kamiyul nila Johnson and Johnson sa namos min melar sege del booster la sege del booster la time magdugo kundi tal Moderna do bang al Horus ending CDC am la ma FDA am la kumula sel sugum ngilo Johnson and Johnson del team la imolorus mengu tege del Moderna wal booster
hal mang Moderna ita se mera se Moderna malo Pfizer either or
ngay se
okay
Belar time rukuktia ka Johnson and Johnson na dola Pfizer tirigel mirus ra J3 sabihin may mga booster ng kagil Moderna.
Okay.
Itlil 2 months after sa igil 1 dose Johnson and Johnson ata sa may mga booster. Ang kagil booster tuli ka half ringgil original dose among Moderna hindi half sa igil aklol kakakaros sa third dose sa booster. A third dose, full dose, booster di half for sigidil.
Up until today, now, aringi kora negative side effect try gigidil booster, masel third dose ra Moderna maluben ko Pfizer. Aniya kora negative effects maluben kora side effect try gigidil additional shots lo kiwa booster maluben third additional dose.
So tulik nga director siya milara dose medal dia sisiway kal side effects ra asira gimwa ongero LL third dose so ngwadim lo maring letkalul ima kal talmlaringa orus ringi koramal din na dai chobersel day after hindi sa idal second day nga koram lom sawlab dangir koram no swal maring laptulu maktimili mataylenol hydrate malima pokari malima chloral ma
I see.
Elang kita kafal buk ngilu yang kita le booster ringi mahal ito kari luwasang luwang nga booster ringi.
Kamu ay sa kafar.
Hindi akong baktirek kalo sisiw tulig ngilu ra sa Tuesday eli akora timne taicho bay el tuta pagi sa kora ngora masaw lap dengi ke kora mring lap tulu ke kora sol mo iwol tel labsak ding sa normal ang bulgulak mong Abdengnya ta o react al morongal vaccine bulgulak mong urior. Hindi ra ata kakaro sa nganya ko kura mo dakal sal dakal filang ra man nganya ko mal kura mo osmer. Dingi maplan mo tret ng rampel ding usually hindi erong edad club sa mo
modelacho. Okay, ya kuma gimo malara ela kama rogo na dias broadcasting malara Johnson and Johnson melaki mo malara sa gidel booster wase
Waisay, tuloy mo dito ay salwasay hindi ka umrusra sila blue orior ending ngarngiya umrusra kapsangira klugo kara 5 mo 8 kaya gingarangar along sa state office rangar along dire kal sabadong sabadong luy kapsangila buil gingar selget center ngaray ra direct kal 5 o'clock kapsel mo 8 o'clock kapsay
sila tinibal pedal me mga nasa aban
by day mal ngi dil adal swal me malara booster chapter ngi mal welcome sa baridal mere gay dil basyo al me ngi dil ngu say dil vaccine card len direct kal mo nga testing amang direct kal sa mil me test ngwa booster kamiu
elal sa babong wase
Waisay, elalu ilgab singi labuil, elal sabado nga mo ray-ray. Selget sister.
Telak-telak mo telak-telak?
5 o'clock al mo 8 o'clock.
5 to 8 o'clock na saruday, target center ray-ray, waisay?
Waisay.
Okay, we'll be there.
O si sita metulig agyolingit talo se hindi tirigel adal yilwa second dose February malubong March. Yagid ako mangira baby na orus may hopefully sa yagid week after Thanksgiving yagid sa edal ko open mo tirigel ngilo ang erul lorus ra April mo May. Tirigel ko rang song sa doses sa dollar per time hindi kami yung ngila chay 3 tirigel ko ngila Moderna ra second dose ra February March yagid mal lingit la sa email.
Okay.
Yagid booster. So sumuk mirus ra second dose ra am May malugan June mugtakangan mangil antil ang October tapos announcement sa namusin may malara booster.
Hindi ko mil chay 3 as mil May so yung le chay 3 abi after 2 months imla mo giri lo spera booster.
Oy, okay. Yakba man na meet tila.
Why say?
Okay, we're coming. Okay, 5 to 8 o'clock Saturday. There I try. Why say?
Why say?
Get center. Well, thank.
O sisita metulig at tirigel rokul homebound. Nangilo sa tirigel umsinder homebound ang ila J3. Lakal bagi klagu kaadalo o rexertel tatala kura of the tirigel homebound. Lakan dia kabagi lagi direct kilomdas rakuk mo plan lo sa makarabo do mystery booster.
House to house.
Ada ka boleh alwig hindi agi mo direct mo top dra sub lo sa mo nganang agi mo marala ay bili tirigay gidan homebound mo marusurti sa gidan booster shot.
Okay. Well taken. Kadal mo.
Adim lagi kita update sa tulik wala ka questions sa edal book nga ulgayong masang Dr. Bing.
Okay. So thank you.
So thank you Dr. Bing for joining us again. You're always a popular guest on the talk show, so you can take it away.
Thank you for having me also. Good evening, Mr. Diaz, and to our dear listeners. Okay. So as Gafar has mentioned, last November 14 was the International Diabetes Day. Okay. So, well, next week it will be Thanksgiving week. Okay, and after that, it will be already December. So holidays are just around the corner, and of course, during those times, what do? There's lots of celebration going on, and we tend to eat a lot, and along with that, some would be drinking and smoking, and these can actually increase the risk for developing chronic diseases such as cardiovascular diseases, hypertension, and of course diabetes. Okay, so we'd like to spread the awareness about the importance of managing diabetes, and along with there's also a mental disorder that usually coexists with diabetes, which is depressive disorder. So, as we all know, diabetes is a serious problem, not just here in Palau, but around the world. It is a leading cause. In 2019, it's the 9th leading cause of death, with an estimated 1.5 million deaths directly caused by diabetes. So it is very important for us to know how to manage and to prevent having diabetes. So what are the risk factors? These are being overweight, having a high blood pressure, sedentary lifestyle, poor diet, and lifestyle habits. Okay, and of course, as we increase in age, it's also one of the risks. And of course, there's a biological cause also, which is a family history of diabetes. Okay? So we need to monitor our blood sugar, and as you know, diabetes is related to being obese and having an inactive lifestyle. So we should also watch our weight and hopefully know your body mass index, because having a normal weight helps us to prevent and delay developing diabetes. Okay? So we have to have the regular physical activity, and also avoid other in diet, we have to avoid those who are rich in sugar or fats, and also tobacco. Okay, because once diabetes sets in, then we have to really watch our blood sugar, because it could lead to complications. Okay, such as stroke, heart disease, peripheral vascular disease, eye disease like blindness. Okay, it is also a leading cause of kidney disease and neuropathy and foot problems. Okay, so the managing diabetes is not that easy. There are certain challenges that comes with it, and this can be depressing for most of the patients that are afflicted with this disease. So it's not uncommon for patients to develop a comorbid depressive disorder. Okay, and when a person has a comorbid depression, and that might also affect their functioning, because as you know, depression is one of the leading cause of disability around the world, especially if there are clinical symptoms involved and it has affected your functioning and caused distress in relationships. So having these two diseases in a person is really challenging, and we have to have early intervention and to be able to sustain the treatment for these two diseases. So it's very important for us to acknowledge this, because this has not been usually seen in practice. I mean, like determining if a patient with diabetes has depression and if a person with diabetes has depression, has the symptoms also of diabetes. And the thing is, especially with the diabetes type 2, the symptoms are not that obvious or severe as diabetes type 1, which is usually in the children and the young adults, young children, okay? So usually when diagnosed with diabetes type 2, it's already late, or it might there might also be complications already, and that can be depressing to that patient. So it is important for us to be able to detect signs and symptoms early. Okay? So for diabetes, what we should watch out for, the symptoms of the 3 Ps, the polyphagia, meaning you're hungry, you're feeling hungry all the time. Okay, that's why you eat a lot. That's polyphagia. Then there's polydipsia, meaning you are thirsty and you drink a lot. And of course, when you drink a lot, then you tend to urinate a lot. So the next P would be the polyuria, wherein you have increased frequency of urination, daytime and nighttime. Okay, and of course, along with those symptoms, also you can have weight loss. Okay, and of course, changes in vision. Okay, and other symptoms like erectile dysfunction. Okay, and neuropathic pathologies like having numbness on the extremities. Because the thing with diabetes is that if there's elevated blood sugar over time, then it can lead to damage to nerves and the blood vessels. So,
okay, I got a question. You know, it has been reported from Congress. I heard, I was listening to their program, and they came up. One of the delegates came up with a statement like, in Palau, 1 out of every 5 citizens have diabetes. And they said it's very high for a population of 20,000 people. So what do you think caused that problem? You know, having a high percentage of people here in Palau diabetic.
Well, I think it has something to do with one is denial, because diabetes is related to has a high correlation with being obese, and there's a lot of obese people.
Yeah.
That, and they're not really seeking treatment or because we have the necessary monitoring for blood sugar and skills to diagnose diabetes in our hospital. Okay, so especially now that there is a high incidence among the younger population, okay, young adults. There's been an increase in the incidence of diabetes because nowadays, one thing is about physically being inactive. Okay, so most of our children are into their gadgets. There's not much physical activity going on.
Right.
And if they are eating a lot, okay, not watching their diet, then chances are there's a risk for being obese.
Dr. Bing, I strongly believe that your health, or you are what you eat.
Yes.
You are what you eat, and the lifestyle of I just turned 72 years old, and I watch what I eat, and I monitor my myself to make sure that I don't get too diabetic. Let's say that at one time I was told that I'm on a borderline, so therefore I watch what I eat and how much I eat per meal. And I think at 72 I have not been told that I'm a diabetic. And now you mentioned different symptoms like urinate often and also want to drink water all the time. All those symptoms that you're talking about, I have not experienced, but they told me that if you drink a lot of water, that will clean your system. And I'm a gout, I have that problem. So I drink a lot of water, so I'll go use the bathroom lots of time, but that don't mean during the day, because my water consumption is very, very high.
Yes.
That don't mean that I'm a diabetic, right?
No, because you have gout, then you need to have increased drinking of water in order to pass out the uric crystals. Okay, that's why you need to drink a lot of water, and that's why you drink, you urinate more because of that. But it does not necessarily mean that you have diabetes, because there are other factors and symptoms that are related to diabetes. And very important thing is the monitoring of the blood sugar. Okay, because an elevated blood sugar is the thing that we're looking out for when it's the one that's used to diagnose diabetes.
But see, I can share with you this information because, like I said, I'm 72 years old, and when I remember those days where we walked like from my village here in Ngarmid all the way to Palau High School, or near that area, PCC area. We walk every day from Ngarmid to our elementary school in Koror, and then back to Ngarmid. We walk every day. And those days we didn't have any really cars that we can ride on, so we do a lot of walking. We do a lot of going to the jungle to get firewood, to cook our food. So there were a lot of physical activities we were doing those days, and we didn't have a basketball court, but we played baseball on the road, and stay active. And we didn't have really much money that make us can afford to buy a sweet and also high in fat, like hamburgers and stuff like that, So I think this new norm, we call it new norm, is to be blamed for this high percentage of Palawan citizens that are being diagnosed with diabetic, because I think our lifestyle, and now all of a sudden we have money and we can afford to eat those rich people food. Don't you think that's the cause of problems?
Yes, of course, partly. And the sedentary lifestyle, as we have pointed out. Like you said, there was a lot of physical activity that during your time during your childhood.
Right.
Okay? So there's less people who might have developed obesity during that time, and of course the blood sugar might be controlled because of that.
Yeah.
And the thing is, when at this point, the internet, the information is quick, so the generation today, they have tend to, they have quick access to a lot of research, and that also entails going to and from the house, and also there's this immediate gratification that they have, so they get maintaining their physical health.
Yeah.
So they end up being overweight and later on being obese, and that's a big risk for developing diabetes.
I see.
And the thing is, there's also this what we call the body shaming, right? That's happening. That people who are fat might feel more depressed. So that also brings about this depressed feeling. And just like what I said, the coexistence of depression and diabetes can take its toll on the management and treatment of diabetes because of the lifestyle changes that has to be done. When someone is depressed, then they might have less effort in doing those lifestyle changes that could have helped them in treating and managing their diabetes.
Right, but you yourself, a doctor, so you know that depression, when a person is depressed, where are they going to go? They're going to drink alcohol, they're going to eat a lot, okay, and that will lead you into overweight, and when you're overweight, more likely you're going to be subject to, diabetic.
Yes, and it's not just diabetes, but also the other the chronic diseases like hypertension, cardiovascular disease, and this can all lead to stroke and heart attack. Okay? So there's an increased rate of death in those people with chronic diseases.
Okay. Excuse me, let me make this announcement. Good evening, and if you want to make a comment to Dr. Bing's statements or suggestions, please, you can call us at 488-4949 and either comment or ask questions, and then Dr. Bing will be able to answer your questions, okay? The number is 488-4949. Okay, let's go back to our program. Okay, back to you, Dr. Bing.
What else?
You make me scared.
Why?
Because, now I'm hungry, I haven't eaten. I'm afraid to go and eat my meal.
It's about eating a lot more than 3 meals a day, and there's the feeling of being hungry all the time, the feeling of being thirsty all the time, okay? Because of the too much sugar, and that's why you urinate a lot, because you have to pass out the excess sugar that you have. So those are the things that have to be considered. And of course, we have our time of meal each day, and the usual time that you have it, then you're supposed to feel hungry during that time. So if you haven't eaten, then it's a normal reaction if you're feeling hungry right now.
Yeah, I've known people over 30 years, they're diabetic, but they've been diabetic for over 30 years. Is that possible? How did he do it?
Because we have medications for diabetes, and the important thing is to be able to control your blood sugar.
I see.
Okay, because like I said, if your diabetes is under not controlled, okay, then it can lead to damages in the nerves and the blood vessels, and that's why it could lead to blindness, the one we call diabetic retinopathy. Okay, so there's damage in the nerves and vessels of the eye, of the retina in the eye. Okay, and then kidney disease, okay? So, you can just imagine having a kidney disease that's gonna need dialysis, okay?
Yeah.
So, if the kidney is not able to get rid of the blood sugar and or other waste products of the body, then it can also affect the brain, and you can develop encephalopathy. That's why those who have increased very high blood sugar and decreased kidney function or a kidney disease, they can manifest with delirium, which some might interpret as having psychosis. Yes, but it's due to the defect of the kidney and uncontrolled diabetes.
Yeah. Dr. Bing, we have about 10 more minutes. Can I use maybe 3 to 4 minutes of your time to summarize what you have just said about diabetes?
Yes.
Okay. Dalo sa sara malungil ko singe akti summarize ma timo melgor sel ma tugubet sen moktegara tegid diabetes ta sukal terrak ta sukal. Ngagidere lang Dr. Bing melgol was being a diabetic tial sukal ra patengem kita matay kamdangwa sukal mo lawyer sel akobem liil madik saran me sello met tial sugar and momul delta. Seguida dangerous tial selbo close sukal ra patengem etiares ema momul delta ya bon mul delta agel a heart tergangari arteries malubing igel veins rebortra sela patengem solanga sulamdam relanga malgegrel diwa maklungela ui agel murdra selamdam ma direct heart tergao ma kidney ka agel internal organs tergar elanga blood circulation letial oxygen ngara patengem ma circulate to keep you alive. Masugum elang mom eating tial sugara batenge manamo klo mamla mom ringer tial ras el circulate el mora osro imeng mas el men mora brainer ground bateng el mora heart ma at ngela imam tial heart terga o mom per tial ras masugum gurul mere mom muldel ya bon muldel deng mom saik mal ube mo dia hat sal sep el rich ra igel rat ngela o imma igel ra batenge el roid tial heart terga le heart terga o mom bertial ras el maliwe kertial entire el petengem mang kire merelan bogorgi kersel mulase o bom diabetic esolange en kartial ras amuldel ma bol muldel de tomar la madam tomar la kidney gaul heart attack gale en mot kaigal murd el maliwe kertial heart terga ngaria bebil ko diwa maklungela gal iudel ngara mong mom ri kertial ras mura se maliwe kertial petengem mang melgo Dr. Bingel was say gigidere lang asugo mo sugal more likely the stroke kamlo mal obele le kan murdra tulimre lang aras armur tial brain regal meleliwek le tial heart ga omom pringin mas daptulum metengel melmoro imma elsewhere masugo men dia teker gau es gospel sugar dim tergas di mangange melima merkose emru lagel dia lungir tial tem engor dia kotelem. Okay, di seguida qadim le summarize ngilo seguida. I hope you can understand al ngania harmeu. Please nkolara 488 48 48 tabeng wargid. Okay, now back to Dr. Bing.
Okay, well in diagnosing and screening those who are at high risk for diabetes, like I said, there's a high risk for a family history of diabetes. So those who have a history in their family should have themselves screened or checked by their doctors earlier.
I see.
Because by catching it early, then we can prevent or delay the incidence of the diabetes type 2.
So, in other words, you can inherit diabetes from your mother or father's side? You can.
Yes. Actually, there's even what we call the gestational diabetes.
I see.
This is the diabetes that the blood sugars rise during pregnancy. Okay, but they typically resolve after delivery. But during that time that the mother is diagnosed with gestational diabetes, there's increased risk for complications during pregnancy. And these mothers and their children are also at an increased risk for developing type 2 of diabetes.
I see.
Yeah.
Okay. Did I say greater kam gora kakargira dalong lilwa senganya gora like interpret the yaksal why say am correct na kasumak na mistake? Got him let I joke.
Is that it, Dr. B?
Yeah, so, just like what I said, it is important for us to be able to detect symptoms of diabetes and, of course, the symptoms for depression.
Yeah.
Because by treating them early, especially in those persons with having those two diseases as comorbidities, then the better management and the treatment and that we can provide them, and it is available in Palau. So for those who are experiencing depressive symptoms, okay, you can call our BH outpatient department for schedule. It's 488-1907. Okay.
Okay.
And
Dr. Bing, can we get this phone call?
Okay.
Alim ngil ko singay?
Alim ngil ko singay tulik.
Oy.
Tulik kadim grira toktangal. Ali di ko ay satyal tretene. Tulik nga kam nanganak pargi gra okoluma.
Oy.
Lam urnya edera. Kadim naksal mlima koi mamargos.
Oy.
Hindi ela kora man na musakal mlima satyal. Koi makora margos idum blo.
Oy.
Di regal wal kora di kal lumina aliwe kaklool. El silpagi se rakapsi, rakapagi se murabensi, ang ramong hindi nakwaisi. Kita kupi meta silpagi sak mga hindi lahat yan na mubekil se, el kumakaran hindi kal murabensi. Bulbulak mula se am na musukal.
Amalungir ngi obara toktang. Le just lo labalay the symptoms lo se you are or you're not. Mang malungir ngi lang asuma irregularities gar lang kam namo tribe suspect ngi plus giren mo ngel wase arki maloral mo kamral mo o so isprala I like it malungir ngi my advice ang halad ko gira Dr. Bing and dinga ha gomda sa say asuma ngari gel gora question about lang symptoms lambeso ispra badangem malungir ngi obra check up di merede so la to wise gaur mal bered. Okay, Dr. Bing, this is the question. The guy is experiencing some symptoms that before they were not there. Okay, I told him, my advice to him, I told him that it's best that you go and see your doctor, and they'll run a physical test on you and see if you have a problem. Was that okay?
Yes, because like what I said, blood sugar levels is the one that is being used to determine to diagnose a person with diabetes.
I see.
And the symptoms, they may be of diabetes or maybe of another disease, or depending on their lifestyle.
Okay. So we got about 4 more minutes to go, and if you guys want to sign off for now, the line is on you. Sige, dimlegi kita ako rasa del discuss katpar.
Jangan kita adol bilangan niya sol mo.
Okay.
Nakapsulan niya tulig mal kam lewil sele example rakartial ras alqamon buldel iso adalo maklat kul masende kaldil sugal donga yung mo akadamo sa edal mo sugal mo diabetes. Dr. Bing, it's not just sweet, right? It's excess food, fats, and all unhealthy food that can contribute to obesity and diabetes, right? Not just in Palau, you say sugal is diabetes, so you tend to think only when you eat sweet food. So, but it's not just that. It's excessive food and other unhealthy food.
Diabetes is not caused by sugar, okay?
Right.
It's about the impaired ability of the insulin to decrease blood sugar, okay? And if there's for the type 1, the body does not produce insulin because the insulin is the one that lowers the blood sugar. Okay, so when we eat a lot, okay, so it's not just the sugar but also the cholesterol, okay, that must be considered, and the triglycerides, okay, and when we are stressed also, that also increases the blood sugar. Okay.
I see.
And when that happens, when it's happening for a long time already, it can lead to damage to some of the body systems because of the damage to the nerves and the blood vessels.
Yeah, I'm kind of confused now sometimes when I was in the military, like when we do a training, during the training we kind of losing our strength, and then they give us something sweet because they say sweets consist of so many percent calories, and calories will boost up your physical body, strength. So they give us sweet, or if you want to keep sweat controlled, they give us a salt tablet, to retain your sweat, so it doesn't, because we don't want to get dehydrated. So they give us a salt tablet to hold that sweat within our body, so we don't dehydrate. And they give us sweet to boost up our strength and also the physical body. Is that correct, or am I being wrong?
Yes, because if you are having a strenuous physical activity, we wouldn't want for you to develop hypoglycemia, which is the decreased blood sugar. Okay, because having decreased blood sugar can make you feel weak, and extremely low blood sugar can also develop other symptoms such as having delirium and having confusion, and that's why some who are diabetic, when they develop hypoglycemia because of their strict diet or they do not eat at the proper time, they might develop hypoglycemia, and that's one of the things that we should watch out for, because it can also have an adverse effect and can also lead to having complications.
I see.
One of those is they might be having delirium, which might also be construed as having psychosis.
Okay.
Oh, ano sis, Diwan. Tuli ko mang announcement pero ma'am.
Oo.
So gidetel masata gayidel raktel wa sugal ma high blood ma carcinoma. Ngaringi sel udo del lul tabdiyar adar olbira kalulaw del NCD fund NCD funds plan. Te longra ringi triyegi del kamitira National Coordinating Mechanism for NCDs. So tamla Ministry of Health and Human Services provider sa del administrative support del more sa del committee. Officer NCD ma prevention unit malaya applications el mo fundang del project malubeng gora program rabalu el niya ultrak lay del rak del NCD.
Okay.
Teng mrulaw rio el niya amo sob a cliff gora ol nga sergi dra ungil tetele laklangar el niya mo prevent ay del rak mangarniya sa level apply ra 5,000 mora gora magikarel project malubeng 25,000 sila one organization na sabel either yung apply ra 5,000 malubeng 25,000.
Okay.
Application sa edel may almutel ko makalom so edel sa edel may ra tel office ra NCD nga ra PCC. Malubeng office ra prevention unit tel nga ra VIP building sel nga bitar sel mutel United Airlines office.
Okay. Kagamit ka talgibel gwas modil ko ra mo takran dira tokla. Okay. Let's say nga ka makaparal adar nga remedya ki ngot titirar buy nga remedya mot makem mergoru lia programmer gamamel girela tokora NCD ngigelo sikat mo mga sarap trula ara amaang solang mo ya kalama make sure ang igagid may gagidil ka lagi gigidil kora expectations ra tegil tokora NCD lang amo partra program most amal apply up to $20,000 support to tegil tokora NCD kamama mot mageruli senso eder polwase
sabi tuli kandi al sumong kumkukti di imo maluba kumkukti ko makafar nda kalsal sabi ngirel let's say new darang aramid ang rayo darang aramid ang kafar ang yudarang aramid el-establish el gimodin masya kung yudarang aramid
okay
pero kung al-dabe el-rang aramid es sabi el malubeng ngidil not for profit tatakal sa el-mora businesses non-government not for profit malubeng government office sabi el-apply ringil mora wato ko health promotion al subong kaso minsan sa exercise ro mirabulurang armid alubeng ngora sa serang armid away gigidel ngora sa telelauriora sa pelegaludo del mom oiteringi
mas amal luasa project que mo ruringi amo malamot marata ora ulariu eso la nusagil detail presenter sagil request mo amal mora NCD tir o mesra purpose ringi ma involvement tra sa truataang etela disira ade mergomo funderingi lo ya gigidel ludo tra NCD ngwai
okay ali application sa tura December 3rd 2021 ngarngi letablong a workshop sa El Almandra November imora workshop pelgibo moruring yakluguk ra West Plaza ra 8 telmo 11 ira adal mera klugo ge ogera questions sa gimo present the information al gira lega gidal applications maigel nya tetele laurior sa amal fund ogore ol nga zero kami ay gidal tayidal omoruring ilogora ogera nga kalkmasay kang sa PL gigida ku sa amal ngo sugumira royal das mangi dilaga sa PL el May ndakal ngi dilagang al sumo kom tera kora al malubeng obis ra government en sabi will mo kat adu may magi ngo sugumira gigida application sa min
okay mangira del mo organization rablu el de kala at least sesel adrablu ya project el pomoruringi at goal blue kirela blue ra wa ngarbiden kora program el mo malmot magdamat sara al duk lang agigid lang o promote lo ya tayid kora NCD
moise
ko dire lo se ngara mo goliu mo swelver gmi mas kama malista gel sa mo ngara selbo gimo swelvo
malwaise tuli galing hasta ko mga smok class ko ra exercise mga ra di ma mara ra public health amal di malgol masesel ko morura sara toy yo ko mo tapyar di ungil mong kaya kam exercise me mo nga gay ko marang al tuko mong gay yung kiren mal ko ra ditel give enya klo yasay ma fruits so ay kita mo tretele laurior mong ra blu oba ding warang kal segi del 775 1138
okay
tinakal nga niya kasi rin sa biil ko lang nga
tahal tungkol tal ko le Ali yungil kabasangay.
Oy tulik manuil kabasangay ma. Ulo ko na program di mga nga interest trigger sa roger kaya imo ato ko.
Kabo.
Agay na ko ra ka farma amra hospital tiga nga frontline awat yagir. Isko git tilang nga kabunyan berbelaw ngarngi tilgele duit magngel aveg.
Ay.
Ngarngi. Pero nga staruk sirniya egora amra gisir wasing kita babiligi merweraw.
Hindi akahala pa.
Wala iserem dia.
Kamle meo del gol tilata amle gol til gimo sader ngi at na ogertir et mula se sel partra public health de chega lo se tirgang at sme te dia sel part del guk tira ora ngi semil kat mok tirge cleared ya guk to ora wala igor mangaranga ki guk ngarlela office ra labor ma.
Oh ndi andi ama man sulang tulik.
Okay.
Mutila hospital ko sulang akmal akmal milgise.
Oh okay.
Okay,
mira, oi bye. Você conhece Edolmo?
Moise.
Oi. No, gid mili web no meu del ndi nesan mo tnge at least ak nas modil morgi. Okay? Ndi mlege gid Edolmo?
Oi, ndi mlege gid mal mesaule.
Okay. Mandiame mal mesu mo goe ka pare poto ko bi makuk next week. Ndi ka next week ndi ka nut mo taklisya next week ndi al bornya show unless ngarinya mal important information Giretto del Morapuay. Moise?
Moise tuli ka gidi ayamal lo sedo edo dolingita atrablu lo sedo lungul next week lengora Thanksgiving itself.
Ay.
Man sugo mendia ka kora urud el gira del mo masad et ito lungulan next week, masel kuk December 2.
Oh.
Ito resume ra talk show again.
Okay. Gara malungil.
Madalway sa tulig man sulang kiti mo reng ramal lungil Thanksgiving in advance and more beklat. Makuk next the bear talk show.
Okay. Leigaro gui. Bye now. Have a nice evening.
Bye.
Okay.
Belak malumi, belak malklebo, baydorai, bome sabalwal mabli, takol warar elang. Magatagat